Psychiatrists are warning children in Scotland are coming to harm while on hidden waiting lists for autism and ADHD assessments, despite mental health targets being met for the first time. The Royal College of Psychiatrists says the Scottish Government should be transparent about thousands of young people not included in official figures for child and adolescent mental health services, otherwise known as CAMS, but who are sometimes waiting for years for neurodevelopmental support. Our health correspondent Lisa Summers reports.
It was very tricky. I wasn't in school, so I felt very anxious about leaving the house a lot because I was struggling. I didn't have that many friends.
Rosie regularly meets her support worker Rebecca at an Edinburgh charity. They've been helping her return to school after struggling with anxiety through COVID.
What classes did you have today, Rosie?
I had English.
Rosie was first referred to child and adolescent mental health services at the age of 8. It took 5 years for her to be diagnosed with autism. Only after that was she able to access help. The teenager, who also lives with fetal alcohol spectrum disorder, credits Rebecca with helping her manage her conditions.
I'm definitely a lot more bubbly of a person. I wasn't as smiley or as happy back then, but she's definitely helped bring me back out of my shell.
Last month, CAMS targets were met for the first time, but the official figures don't include children referred specifically for neurodivergent conditions such as autism or ADHD. Psychiatrists say these young people are moved onto separate waiting lists with no requirement to record how many children are on them or how long they'll have to wait.
But when you have children who I suppose are at risk, who are self-harming, who are not eating, those children, rightly so, do have to be prioritised. But it doesn't take away from the fact that the children with the neurodevelopmental conditions do still need a diagnosis sometimes to receive the correct support. And it's the same staff doing the same job across the board. If children are waiting years, I suppose that's having an impact on their education, it's having an impact on their social life, on their family life. So those children are being let down.
The government acknowledges long waits are unacceptable, but says it's increasing funding to improve access to services. More awareness of neurodiverse conditions has contributed to growing numbers of young people seeking help.
Demand is huge and we're only scratching the surface. We do try our very best, but we can't possibly respond to the levels of demand that are out there. It's just impossible to service.
The Royal College of Psychiatrists says publishing data on neurodiversity is the only way to fully understand how many children are waiting for help. Lisa Summers reporting, Scotland.